Thank you, Honourable Speaker, sir, and I thank the Honourable Member for his question. So the Ministry has acknowledged that there are existing salary discrepancies affecting healthcare workers employed by the Ministry. And some of these discrepancies have existed and remain uncorrected for many years up until now. So the Ministry recognizes the importance of addressing these salaries discrepancies for healthcare workers, including the oral health professional and allied health professionals employed by the Ministry, and is all very much committed to this process. So it is an ongoing process and does take time and effort and require wide consultation with stakeholders, including the government agencies. So we have started our nursing cadre, which government had earlier endorsed, and likewise we will anticipate other cadres within the health care sector to also put in their submission. At the moment we are looking into the medical imaging technologists, which the Honourable Member has also raised in Parliament last session. So the Ministry will continue with the process to ensure that salary issues of its workers, including more than 200 oral health workers and more than 500 allied health practitioners currently in the Ministry, are appropriately addressed. Thank you, Honourable Speaker.